13 News Now at 5:30 begins with concerning news for our young people. A new study from the University of California, San Francisco found half of young adults struggled with mental health last year, and more than a third reported they couldn't receive the counseling they needed. Riverside Health is trying to help people facing a mental health crisis in Hampton Roads. Dana Smith has more on the first standalone psychiatric emergency department in Hampton Roads.
For a broken arm or leg, a hospital emergency department is usually the first stop. But for an injury you can't see, where to go isn't always obvious. Riverside Health System is changing that.
Psychiatric emergency departments or urgent care clinics that specialize in mental and behavioral health are really becoming much more popular nationally.
Next year, hospital leaders are launching the region's very first standalone psychiatric emergency department. Riverside Health System Vice President and Executive Director of Riverside Behavioral Health Center, Stacy Johnson, said the sheer number of visits to Riverside's emergency department by people in a mental health crisis helped hospital leaders realize they need a separate emergency department that specializes in mental health.
We did see an influx in our psychiatric patients in the emergency department.
According to the Centers for Disease Control, mental health crises represent more than 13 million emergency department visits annually across the United States. Johnson said the COVID-19 pandemic highlights the need for better mental health care.
The last year, about 1,700 patients arrived in our emergency department that needed inpatient psychiatric treatment. So if we add all of the individuals that didn't require that intense level of care, I mean, it's much higher.
Riverside Psychiatric Emergency Department opens late next year. Johnson said it's another way for Riverside to offer personalized mental health care for people who need it. Dana Smith, 13 News Now.
Johnson said the psychiatric emergency department will be staffed by doctors and nurses who specialize in treating people experiencing a psychiatric crisis and will offer short and long-term recovery support at the center.